The hospital is still packing the meals. It's not perfect, but they're doing pretty well. I'm going along with their recommendations on how they want to do what they want to do. And that's it. It's working.
Great. Yeah, it's busy.
We have about 50 clients on the program, and a number of people come off and come on, fallen, broken hips. It's been an interesting summer, interesting July. Okay.
Yeah.
Okay, thank you.
No doubt. Okay. Any questions for Marianne? Lynn, I guess. Not much to update, right? On for Lynn, did you have anything you want to add?
No, I don't think so.
Okay.
Thanks.
All right, thank you. Karen. Yeah, Karen.
Good morning.
Hi.
Our prevention team's was busy during the month of June on a range of things. We filed for our Drug-Free Communities grant no-cost extension since our grant officially ends at the end of September 29th. So we did file for a no-cost extension that would hopefully give us some funds that we can continue to use up to 12 months after the end of the grant. We have not heard back on that. We've also been working on getting the new vaping grant underway, working to post the position for the part-time person for that. We've put together a substance use resources PSA with a Needham channel. We are, as Carol would probably be able to say as well, concerned about not being able to put our eyes on people in the community so much, and we want people to know that there are resources for assessment, treatment, recovery, and so on still available, and that it's safe to come to get those resources. So we did a PSA around that. And then finally, the month of June was very busy for our SALSA students. They completed 4 projects, which is pretty amazing considering the circumstances, but they've been quite engaged in the community between PSAs, vaping awareness, and engaging with rising 9th graders coming up from Pollard. And then other than that, we have also, our department has, the HHS department launched the initial meeting of a racial equity committee that our division is taking a look at the way we do our work for racial equity, and we'll assess and decide what changes or new things need to be implemented with response to that.
Mm-hmm. Great. Yeah, I like the Get Connected Needham. I've gone on there and seen some of the posts and stuff. Very good information for people. That's great. Any idea on vaping, like now with kids home so much? Any thoughts that maybe it's decreased?
You know, we touch base often with Sarah Shine Youth and Family, because they are the ones who, next to parents, really are our closest connection to eyes on youth. Mm-hmm. And they have reported anecdotally that not only are their rosters full for counseling, but they are hearing among the amount of stress and anxiety youth are reporting, vaping is obviously continuing. So we're concerned about it, certainly, and we're hoping that this vaping grant will give us an opportunity to implement cessation resources for youth.
That's great. Thank you. Any other questions? Okay, so I guess we're on to environmental health. Thank you, Karen.
Okay, I can start off. So basically, as you can see, we had a pretty large uptick on food complaints in reference to masks and things. Diana and I have been trying to get that education out on the masks. I went down to Cafe Fresh Bagel, met with the manager again about concerns with the ongoing complaints in his establishment. I gave him some talking points that what he could use of a big group of kids coming. This is usually what happens when in the mornings. He gets more busy and he has everything lined up on the floors and socially distanced markings and things. But what happens, a group of kids come in 6 at a time, and then he's already almost above his halfway max of his establishment. He has a 10 max number on his door for occupancy, but people walk right by it and don't really pay attention to it. So I said, well, you got to tell one of the kids to stay in, take the orders, or go out right when you get your order, or just be really consistent with that. So he's going to try harder to make sure he can maintain that. I gave him signage. I said, post the signs on the walls, everywhere you can on the mask wearing and the social distancing requirement. Tim can tell you more about Costas. We've been on him as well and his staff to make sure that they're wearing their masks and wearing them properly. And we had a good report last time when Tim stopped by. He didn't recognize Tim, so yeah, inside scoop on that. But Paige, again, our intern, she's been great at helping us get the PSA out on the masks and the Board of Health ordinance. So I think we just have to keep hitting everybody with this education, and this is what we need to do to keep everyone safe. It reminds me of the glove wearing protocol that went in enacted years ago on having to wear gloves, to prevent bare hand contact. It was almost the same exact thing. We got a jump and spike in complaints, and it was just constant education and teaching everyone about the protocol. So that, but I think we'll get there at some point if we just keep on.
To add to that whole thing, the complaints that we're getting too, it's not only staff incorrectly wearing masks, it's also customers. We're getting a lot of calls of customers calling about other customers because the staff, it is an awkward situation to be in, to go up to someone because you don't know how people are going to react when you do ask them. So it's been a lot of mix. So I always have to call and verify who actually was the one not wearing the mask, because a lot of the time it's been customers coming in without a mask. And then it goes into that whole, if they have a health issue, do they not need to wear the mask? Yeah. People don't understand that you don't necessarily, they could have a health issue going on that makes them exempt, but they look healthy from the outside, but you don't know what's actually happening. So that puts a little bit more difficulty, because I think that increases the complaints, because it's that side of it too. Yeah.
So again, they don't want to really on down hard, because some of these customers come in and they're very agitated about that whole piece. So it's again finding that balance, if they're going to get unruly and make a scene and start, it's like you got to use your best judgment on that. So that's what we're just going to keep pushing out. Just a quick update on our FDA standard items. So we're making great headway on standard 7, like I mentioned last month. So now Paige is working with Donna Moultrup from the North Shore and Ruth Clay, and we're almost there to get that standard audited. So that's good news. We're still making some headway on that. We're also chipping away at standard 2, like we talked about. Diana and Monica will be getting their trainings with Pamela and going out in the field and doing those shadow trainings to make it a more standardized inspection approach. So that's also in the works. And Paige, like I said, has been great on helping us keep up with our binders and updating those. So, and I'll talk about, if you want to talk about the pools and other things we've been busy doing.
Yeah, so all the pools now have been permitted officially. There's only one, Rosemary Ridge, the only pool that decided not to open this year. That's a residential apartment complex pool, and it's very low use that they didn't think it was worth the investment of opening this year. That was decided by their board, which is totally fine. But we had everyone, so all the apartments, any outdoor pools, there was mostly apartments, and then the town pool as well. We worked with all of them to make sure that they really understood. I sat with all the pool operators and had the guidance from the state and literally sat there, read it out loud, and made sure that they understand everything that was required of them and had them sign off on that. And then we just kept going over capacity limits, lifeguard requirements, making sure that they had all the social distance markings around the deck, removing unnecessary furniture, and just they hire additional staff, so a monitor. So by the guidance from the state, the lifeguards are not responsible for the cleaning or the monitoring of the amount of people there. So most of the places hired an additional person who will man the entrance, who is responsible for taking information from each person coming in or each group coming in, so that they can better have the information for contact tracing purposes. And then that person is going to be in charge of kind of maintaining the rules, cleaning equipment. So a lot of the places decided to do reservation-based systems. So it was like from 10 to 12, basically like 2-hour blocks would be open. You have to sign up online ahead of time, and you can sign up, get your block, and then in between blocks, the plan is to clean out the whole entire area. So like all the deck furniture, anything that people would have been touching. So it's emptying out the pool periodically, cleaning it out. And I think we're fairly confident that people will be keeping up. Haven't really gotten like any complaints about it. The only complaints that I hear is from the pool managers themselves telling me that the guests are complaining that they have to wear their mask even when they're sitting outside of the pool, because we were emphasizing that the only time people cannot or do not have to wear the mask is when they're physically inside actively swimming or swimming in the pool. So it's like, I think people just get frustrated because they want to sunbathe and not get a mask tan, but we're encouraging them to have that on. But yeah, so that was a big thing, and the town pool open this week, so that'll be interesting. I think it should go pretty smoothly. They work really, really hard. I think they work the most on their protocols just because it's the biggest facility that we have in town, and a lot of people want to come in.
Are the hotel pools open, the indoor ones?
So the indoor ones, they're about to open. So we were in discussion this week. So right now I know Homewood Suites and Residence Inn are planning to open this week or within the next 2 weeks. So I gave them the indoor guidance. They've been maintaining the pool regardless of people going in, but we've asked that if they can make a key or have a special code to get into the room to have the guests check in at the front desk before going into the pool area, just so they can maintain. So I think it's 10 people maximum in either pool. They're both really small pools. And I've been trying to reach out to the Sheridan. I haven't heard anything from them because I know they were closed for an extended period. So obviously they still need to they would have to get re-inspected for sure for the food, probably the pool too. The other pools, since they had been maintained the whole time, wasn't so adamant about checking. I'll do a spot check probably before the end of the summer. But since they were still there on site maintaining, it wasn't as big of a worry. But the Sheridan, I have no clue what's happening there.
Right. Oh, hey, can I just suggest the one restaurant in town where there's an employee who can't wear a mask? What about a face shield for them?
Can bring it up. So I know of 2 places, so Costa's and then Cervante Bakery have staff, 1 member each, that have medical exemptions. I can bring it up that they wear masks because I know for Cervante it comes up again. We've discussed it. Like I just talked with the owner because she's the one she has the condition, but she just wants us, like she feels like she's getting a ding on her record because people keep calling, and I'm telling her that we just have to follow up with everything. I think she has a sign on her door that explains that, but people don't read it. Yeah. They just walk right past.
It might help her, just to get,
Right.
I can definitely recommend
You don't
that.
want to send a message that a face shield is an alternative.
is enough. Yeah.
In this case, I think it's appropriate. It will stop large droplets. It will not stop small droplets, though.
Right.
That's the danger with these.
Right. We know. We know, but I do think it's better than nothing. So,
Absolutely.
Yeah, I agree. Okay, trying to stay on time. I ran too far over last.
No worries.
So, any other updates or questions on these for environmental health? Okay. Who we have to? I think that is, and now we're sort of into the. I'm just looking at the agenda. Sort of the COVID update, status update for Needham, which I guess we did a little bit of, but if there's anything else to add.
I think there's probably plenty to add. If Tiffany could maybe start, she prepared a couple of slides with some data, and then we can jump into some of the challenges we've been having, some of the complaints we've been getting, some of the coordination issues.
Great.
Yeah, so I ran the usual reports that I've run the last couple times. So we have our total confirmed cases. As you can see, Needham pretty much flattened the curve by the end of May, but it started to flatten like mid-May, which is good. So we've had a major decrease since May. And then our total cases per day definitely decreased. You can see there's some that we didn't even have any, which is nice. However, I will caveat that those have changed with July. We are seeing an increase in July. Our total isolated and our quarantine, so the isolated on the top are the gray, the quarantine on the top are gray, the isolated are the confirmed cases in the orange. And for the most part, that's kind of stayed the same through June, but we will see an increase probably in July again on the probables versus the confirmed. And that I can get into in just a minute. Then the other things that I have were more out of my curiosity as to what the demographics kind of look like for confirmed and probable cases, both with our long-term cares, because we have some really big long-term cares, and then outside of our long-term cares. So those are, the next few slides are what I pulled the pivot tables for, excluding the long-term cares on the right-hand side of the screen. So as you can see, our ages change a lot once you get outside of the long-term cares. Our increase in younger kids under the age of 20 gets bigger by almost twice percentage. So it goes from 5% to 10%. And then of course our higher age, higher risk group gets a lot smaller in those ones. And then the next one is, I decided to break it down by race. So we have our confirmed cases by race. And I found this one interesting because it does do a little bit of switching based off of outside of long-term care. So you can see like where and which kind of races receive it more outside of the long-term care. So that's interesting. And then our age, our gender is the next one. And that demographic for the most part stays pretty close to the same, which is females have gotten it more here, but on average, it's pretty close to 50-50. So, so those are those cases. One thing to note that we're seeing and that I've spent a bit of time with in the last couple weeks, specifically with the state, is the difference in probables versus the difference in confirmed. In case people aren't aware, there are 3 different testing types. There's your PCR, which is the only one that gives you a confirmed status. There's your antigen, which gives you a probable status. And then there's your antibody, which also gives you a probable status. And then with those, there are 3 different scenarios within the antibody and 2 different scenarios within the antigen. So there's a lot of different variables that happen here. And what we've been seeing in the last couple weeks is we saw particularly children getting tested with the antigen, because they call it the rapid test, and it comes out positive. And then they have gone and gotten PCR tested and it's come out negative. And the state still requires them to isolate as if they were a positive test. So I went back and forth with some of these. Some of these had dates with 5 days, 6 days between, but the last few have had like the next day or 2 days later, they've gotten the PCR testing. And the state is very adamant that they are still considered an isolated case, a confirmed case with a positive antigen. And those who get a negative antigen need to get tested with PCR because the negative has a very low specificity for the negative antigen tests. So trying to work through all that and figure all of that out makes it a little difficult when you don't have a confirmed diagnosis with an antigen test, because it's hard to explain to people why they're considered a probable and they won't actually show up in our numbers that the state reports out every Wednesday. So running reports and total cases, the state reported as of last week, we had 341 confirmed cases. As of the end of June, we had 404 confirmed and probable cases. So you can see where that change and shift in isolated cases actually happens. It's almost 60 depending on if it's antigen or antibody. So we've been dealing with that a bit, trying to work that through, and it's been interesting. All of the tested antibodies that have been positive, or sorry, antigens that have been positive have come from the same facility. So I brought that to the state as well. And then to note, as of yesterday, I got a call from a family that had stated they tested positive, but never received a call from public health. So I was talking with her, and she also got tested at the same facility. And I ran their names in the system and I couldn't find them. So I'm inclined to say that they were having an issue with the specific facility. And I've heard from other residents who've tested positive there that their providers are concerned about that facility. So I've brought that to the state to see what they're going to do, and I haven't yet heard much back from that. So those are a few things we're kind of dealing with. A few concerns I get is, why isn't there more testing? I get calls from seniors a lot at their assisted living facilities. Why aren't we doing testing? Why aren't we mandating testing? Those are some of the complaints and concerns. Get a lot of calls about if I'm going to go do this travel, what does that mean? If I travel here and I'm only there for a certain amount of time, or I don't do X, Y, and Z, can I come back and not quarantine for 14 days? So those kind of things. We also haven't heard from the state yet. They're supposed to talk on our call today about what the quarantine really means for public health for travel and what we're going to do. They do expect from the governor's discussion on Friday that the local boards of health will have to enforce that. It sounds like the CTC, the Contact Tracing Collaborative, will follow that, but it sounds like the enforcement will fall on the local board of health. So it will be interesting. So yeah, so those are some of the major things as far as COVID that we're dealing with. Does somebody have a question?
Yeah, on the antibody testing, how are the, you said those are treated as probables?
Yeah.
Okay. And why are they probables and not confirmed?
So antibody has always been a probable, because if they haven't had symptoms, based on which antibody is run on them, and then based off of their symptoms, they don't necessarily need to isolate. It's the antigen that the state is saying, if you're positive antigen, then it's a confirmed, no ifs, ands, or buts. But we don't know which test of antigen they're using. We don't know which, how good its specificity, and we don't know if it's one that's been approved from the FDA. So that's where my major concern comes from.
All right, and then if you have somebody who tests positive for IgM and IgG, does that make any difference?
For which ones?
IgM and IgG.
So kind of. There's a whole table based off of the IgM, the IgG versus the total Ig, and what we go off of, whether or not they need to quarantine. But it's really based off symptoms. If they haven't had any major symptoms or any symptoms at all in the last 14 days and they just had an antibody, they're generally cleared. You don't have to quarantine.
Okay.
So
the testing's a mess. It's because even FDA approval doesn't really mean anything. I mean, it's just, I mean, they're not really reviewing much. So, and some debate about these tests being overly sensitive, right? The PCR, and anyway.
Well, the hard part is trying to be like, we've been pushing the PCR as the gold standard. So when people get antigen tested and are positive, and then they test negative on the PCR, they're like, well, why aren't we taking the gold standard? And I'm negative, I've had no symptoms. So why not, you know, so that's.
Yeah, the false positives on the antigen is weird. Okay, I don't want to hold things up. We could talk about this whole day.
Can I say something? This is Carol. I just wanted to reflect on what Tiffany was saying about the local Board of Health calls on Tuesday and Friday. I said it before, I'm chair of our Medfield Board of Health, and just listening to you, Tiffany, and what you're balancing with not a full-time nurse with you, and then losing soon your part-time nurse, and the enforcement that they outline on this new governor's order that will include college students, and the lack of testing. It's just incredible, the work that you're having to do, and I suspect you're also working, Tim, and you with Dan, and the school reopening. And I say that because I know you've had a bit of a bench with the school nurses, and in our town that has changed now with summer programs and back to school. So the other thing I just wanted to say is the state in these calls have all these leaders, DLS and DESE and DPH, and they have been traditionally having Chief Jeff Farnsworth, Mass Chiefs of Police, and he continues to reiterate that the police are not the enforcement of these regulations, with like Tara and Diana are outlining with the anger with the citizens and the masks, and due to the the challenges with policing, they continue to remind us all that if our staff is in danger or needs support, to call local police. But basically, the police are not gearing up to work hand in hand. So I'm just kind of processing that you're doing a lot, and Needham's really fortunate to have you and Tim and Diane and Tiffany, because it's only going to, it's getting more. I mean, we had a little maybe lull, you could call it, but I just had to reflect.
So you brought up a good thing that I know, Kathleen, you stated before that I should have touched on with the colleges. So DPH did talk a little bit about colleges, and originally they were like, no, not doing their own contact tracing. Now they're kind of pedaling back on that a little bit, but it has to be in coordination with the local public health, with how that will work and how that flows. I got contacted by Olin College at the beginning of June, but I haven't heard from them since. So I'm not sure what their planning or their thoughts are on any of that. And then also with the increase in probables and the requirement for isolation with that, we've been working with the CTC, the Community Tracing Collaborative, and I have been sending cases to them to see how that will work and how those confirms will go. Unfortunately, they can't take on a lot as far as long-term care facilities go. And so if any cases at a long-term care facility gets kicked back to me, which is fine because there's an epi following, so I usually already know about that beforehand. But we are also seeing an increase in our long-term cares, a emergence in those facilities. So that's something to be aware of. But I have been in contact with the CTC about several things. But my other concern is their staff keeps changing. Every 2 weeks I get a new staff member. So it's interesting to see how that will work as we see an increase in the cases. And then we also, with flu, are planning flu clinics. We have increased our flu supply. We've talked to other towns to see if they maybe want to combine, because we are planning to do a drive-through clinic. But that is all, again, assuming if I'm the only nurse here, I can't respond to COVID and I can't do flu clinics at the same time. So depending on how things work out, we will do the best we can, but we are planning to do flu clinics a lot different in this next season. So more stay tuned, and thanks to Talib for helping all of this, and very grateful for that.
Great, thanks guys. Thanks.
Thank you. Actually, I have one quick question. Tiffany, the slight increase in cases in July that you've seen, is there any evidence that it's related to gatherings, or is those just isolated cases?
Most of them have been travel. We've seen a decent group of students coming back from colleges, particularly Florida. And we have seen gathering as far as cases in summer programs that have happened, yes. Mostly all indoor programs that have been happening indoor. But again, those have also all been the antigen positive cases. So depending on what that truly comes out to be, but yeah.
That may be a harbinger of what happens with the schools.
Yep.
I know we're getting to.
Yep.
Yeah, a lot are maybe using that antigen screen. Okay, great. Face covering order, Tim, you're.
Sure. So we'll talk about it a little bit later because it's scheduled for 9:50, but some changes to the state emergency orders, including some changes to the existing ban on reusable bags, which has been lifted by the state, will require the board to potentially revise its order unless it wishes to have a stronger standard than the state and continue to prohibit reusable bags. The staff and I prepared a redline version of the emergency order that would remove that section if the board wishes to consider it, as well as some other minor edits. I do want to maybe return to the issue of face coverings. And then I also want to touch on town elections. For face coverings, we get a lot of complaints, and I think it's stretching our ability to respond to the person who's complaining, let alone then be able to follow up and try to address the root cause or the situation or the restaurant or wherever it occurred that they were complaining about. I know there's a number of people who've complained about an area historically where we haven't been involved, and that is in private residences. So apartment buildings or condo buildings. Historically, with the exception of housing code violations, we haven't had extensive responsibility in that environment. I know there's been a number of, and I think some of them were directed to Dr. Partridge, complaints about the service provided to residents that just own an apartment in an apartment building, what is sort of owed to them by either the town or the management company of that building. Historically, that's not been something we've been involved in, again, unless there's a hoarding situation or a serious housing complaint. We have been more active, given the nature of the public health emergency, in providing building management or building superintendents with signage. Diane and Tara check in with them or visit them. We have limited ability to, I think as the board knows, if we get a complaint, an anonymous complaint, or I saw this last night at this shop, we can follow up with the establishment. We don't have the ability to write tickets or do enforcement unless we witness a violation in person. And as I think we've been talking about, there are limited resources. So our ability to witness violations is limited unless we're literally at that building at that time that a violation occurs. So I know that there are some members of the community that are frustrated that we don't, for example, stop if a physical therapist is coming into a apartment building to help a person that might be homebound get physical therapy within their apartment, and that person is wearing a mask but doesn't have it pulled up over their nose. In my opinion, the greatest work that we can do is working with the building department, the building manager for that building, the management company, to put up signage reminding people of their responsibilities, both to the emergency order from the Board of Health as well as to just sort of the general health of themselves and their neighbors. But we don't have much ability to actually follow up unless the board thinks we can essentially have staff sit in lobbies looking for violations. And I think, as we've established, there's a lot on our plate, and that is not particularly realistic at this time period.
And we have higher risk exposures that I think we have to devote our research, passing someone in the hallway. I mean, it's not great. You don't want to, be there for a long time, but it's not, we don't have infinite resources. So I know it's hard. I think the signage, education, I don't know what else you can do.
Rob, I don't know if you wanted to add anything. I know that at least one resident has contacted you with a long, detailed email.
I think you summarized it very well, Tim. Just like, the police cannot be present to witness every crime. And, as Kathleen said, I think, just continued vigilance with education, monitoring, responding as best we can, given, as has become very clear over the COVID pandemic, the public health department is stretched, and everybody's not at their limit, but everybody's working as hard as they can to protect the entire community, and we need to continue to do what we're doing. And certainly we appreciate all the input from members of the public, but this is a pandemic in which we are all in this together, and we need to respond together And, you know, the response is not going to be perfect, but we have to, you know, continue to do the best job we can.
Definitely. I did want to draw the board's attention to the upcoming town elections. As luck would have it, I got an email from the town clerk, because I'm the building manager for the Rosemary Complex, about the timing for the primary election on September 1st and September 2nd, sorry. And then the September 1st, and then the November election. The state has revised some of its rules and laws around voting to allow for greater participation by mail, no excuse absentee balloting. I wonder if the board would be interested in a letter to the community or considering advice to the community recommending that people take advantage of that option for the health of themselves and for the health of their neighbors, that from a public health perspective, voting by mail makes the most sense.
Yeah, that makes sense.
Great idea.
Yeah.
Okay. With the board's permission, if that's the case, then I would draft something for your review. I'll work with the town's public information officer, Cindy Roy, and also with the town clerk, because I know that she and I have had some discussions about this issue. And for the town election which was what originally was going to be in April, but was delayed because of COVID, the town encouraged mail-in balloting and actually got more mail-in ballots before election day than it had all votes in previous elections, both absentee and regular. So it was something that Needham residents took advantage of, and it seems like it makes it safer for the people who do vote in person, as well as the election workers and the volunteers who staff the polls.
Have they worked out all the bugs with the voting process, however? Because, you know, I was among several who tried to get a mail-in ballot, never got it, and the clerk's office really couldn't handle any of the questions. So I was unable to vote and was disenfranchised in the last election. It's actually, you know, been investigated by the state. So I just want to make sure, if we're going to encourage this, that we actually have some assurance that the systems have been worked out.
Okay.
And we need to be really clear about deadlines. So I didn't know that, like, I got my mail-in ballot and then walked to town hall to deliver it, and they stopped accepting ballots like 2 hours before I got there because of COVID or something. So usually the polls are open till 8 p.m. They closed at 5. Need to be clear, like the deadline, the sequence. I mean, League of Women Voters has good information usually on that kind of stuff too. So getting some info from their website would be a good resource. So.
Okay.
And I think that's good. That's good public health. So is 950, should we deal with, do we need to deal with the revised face covering order?
Yes.
At this time? So is it a hearing? Are we gonna evaluate the updates or changes to the emergency order for the face coverings?
Yep, and since this is a hearing that is part of an emergency order, there is not a public comment period necessarily. You did get, as the board knows, extensive public comment on the original emergency order of whether to require a face cover and in what context. The changes, as you can see in the packet, are redlined to make them easily visible. Some clarification about businesses and where in a business it's acceptable to not use a face covering, and generally we've defined that as a private office or when you're not sharing a common space with someone. We have updated some of the links, including some of the state links, because different emergency orders have been either rescinded or superseded by additional guidance or later guidance from the state, including the maximum occupancy for grocery stores, which is now 10 persons, for retail establishments, 10 persons, including staff per 100,000 square feet, or 50% of the establishment's occupancy, maximum permitted occupancy. As you can see, the reusable bags were also removed. I did work on a little bit of language, which I thought was helpful, but that's certainly for the board to determine for itself. On what is page 50 of the packet, the last page of the order, the second paragraph on that page that says this emergency order does not require, and I struck out as a suggested edit for the board's consideration, or recommend the wearing of a face covering in outdoor settings when a safe distance between persons is observed, or when it is reasonable to expect that a person may maintain a 6-foot distance from other people at all times. That was trying to clarify some of our, the questions that we've gotten about, well, if I'm 6 feet away from people, can I take off my mask? And then if people come into my space, it's not really on me. And that's trying to sort of clarify maybe our reasonable expectation standard, which is if you're walking in front of Bagel's Best at 9 a.m. on a weekday, you don't have a reasonable expectation that you can maintain 6 feet of distance. But if you're walking in Ridge Hill or maybe your neighborhood or the town forest, you do have a reasonable expectation that you can maintain 6 feet of distance, and so you don't have to employ a face covering at all times. That's what I was sort of trying to maybe spell out a little bit more clearly, because that's been a source of question and concern on both sides. It's generated a lot of complaints and inquiries.
Thoughts? I don't have a strong opinion, I guess, on this, but anyone?
I agree with the edits. I think they make sense.
Yeah. Just July is misspelled in the next paragraph.
Yes, it is.
Tim, there's one question I had in the first paragraph after the shopping bags.
Yep.
Last sentence. It says, those who are unable to safely don a face covering due to access or functional needs. I'm just wondering if that access could be interpreted as, well, I don't have access to a mask, so I'm not going to wear one.
Okay, sure. What I was going for, I think, when we originally drafted it was there's been a term, and it's changed sort of over my years in public health and emergency preparedness. You know, it was originally called special populations, then it was individuals requiring additional assistance, then it was or maybe before that it was at-risk populations, and the term right now is generally considered individuals with functional or access needs. But we can figure out a way to maybe reword that slightly so that
Yeah, no, I do understand what the intent is, but I'm just wondering if it could be interpreted a different way by those not in public health.
Perhaps we could just add a sentence, an access need is not, or an access need refers to, you know, a particular condition and the individual's ability rather than their willingness to buy a face mask or something to that effect.
Yeah, just define access need, I think is good, yeah.
Okay.
Standard definition, that makes sense. Okay.
Yeah, the single-use bag is a kind of an interesting question. I mean, we know that it's mostly not fomite transmission, or at least we think it's not mostly fomite transmission, which is why that was put in to begin with. However, you know, those are also not easily washable, you know, you can't always wipe them down. So I don't know what people think about that, or do we leave that to people's discretion? They'll, you know, choose to use their own bags if they want to. I would just be, you know, I would want to make sure that establishments continue to provide bags to those who need them, because in the past, you know, they've basically said, no, you bring your own bag or we charge you or what have you.
Okay.
So maybe we remove we say that single-use bags are permitted, but that retailers still have to provide bags when requested or something like that.
Okay. Is that a change we want to, so we'd word it as reusable shopping bags are permitted in Needham, but are not required, or but the use of such is at the discretion of the establishment or something?
Well, no, I mean, I think the discretion is at the use of the consumer. What we want is if the consumer doesn't want to use a reusable bag and they come into a store,
okay,
that single-use bags are, you know, still must be made available.
So you could say reusable shopping bags are permitted. Single-use bags shall be provided at no extra cost to customers.
Yeah.
Something like that.
do we want to get into the no extra cost?
Are there establishments in town who are charging for bags?
I was gonna say, I'm pretty sure that there was no added costs in Needham because that would have had to been mandated, I think, by us.
Okay.
Okay. I mean, I'm sure that there are other stores in other towns that do. If it hasn't hit Needham, then that would be fine.
Yeah, I was gonna say, like an example, Cambridge, that's a city ordinance that they have 10 cents per bag. So that was the city itself who mandated that. It wasn't the stores doing that. And in Boston, I think it's 5 cents a bag.
Yeah, I think usually that's how it goes too. Few businesses want to annoy their customers. Okay.
Okay.
So with those edits, we think it's okay? Should we take it? Do we need to take a vote now?
You'd need a motion and a second, and then it would be a roll call vote.
Mm-hmm. Can I get a motion to accept the new face covering order?
Motion to approve with the amendments.
I'll second that.
Okay. All those in favor? I will. So we talk. Oh, sorry, Christina.
Yes.
Okay. Rob.
Yes.
Steve.
Yes.
Ed.
I'm going to abstain because I was on a phone call.
Oh, okay. It's fine. So 4-1, I guess. 4 to, I don't know how you count that. So with those edits, we'll go with that. Okay. I want to be able to get to the next item on the agenda, which is the diversity, equity, inclusion discussion, but I wanted to make sure we also covered, were there any other COVID related items like Needham Public Schools? Was there?
So two items, I think, in brief. I included in the packet, and I think it probably ended up being a challenge given the size of the actual file. Two orders, or not orders, signage that has been put out, some lawn signs as well as on the physical boards at Memorial Park, thanking people for wearing a face cover in Needham. This was something that the town's public information officer, Cindy, helped develop, which was great. Last week, I was on a call with the Newton Needham Chamber of Commerce, and a couple of merchants were interested in some of the signs that Brookline has made, many of which are similar to the signs we've done, although they did include their Brookline turkey in the social distancing, which I thought was a nice touch. But one of the ones that we hadn't considered, and I hadn't actually seen a sign like it, was the sign that is page 53 of your packet. You must wear a face cover to enter this business per order of Needham Public Health. It should actually probably say Needham Board of Health. If unable to comply for medical reasons, please call or email us to make it alternative arrangements. Businesses are sort of looking for ways for them not to be the bad guy, or for them not to be at the sort of cultural flashpoint between people trying to make a statement about their rights or their prerogative. So I thought that was a nice way to do it. You know, if for medical reasons you can't do it, we're going to go out of our way to do extra things for you, but please don't cause us trouble by coming into the establishment and potentially making other customers uncomfortable. It's certainly not something that can be required, but potentially with that signage, there could be a way to head off some of those challenging confrontations.
Yeah, I like it. I think that's good.
I think that's good too.
Yeah, take some of the heat off the business owners. And
Yeah, put it on the Board of Health. I mean, that's why we're Board of Health.
Yep. So the changes I guess I would make, which I thought were good suggestions, per order of Needham Board of Health, and then if unable to comply for medical reasons, please call or email us, and we'll put a little box or something where they can write their, each store could write their phone number or their email or both, a blank field that they could put that in. Then we'll submit them, distribute them electronically, and we'll also print copies for those businesses that don't have access so that they could hang them up if they'd like. That was, I thought, a good suggestion from the Chamber of Commerce about how to help businesses.
yeah, that's great. I like that.
The only other point I'd mention, and Christina is on the school advisory reopening committee as well as myself, and I also serve on some of the task forces. Tiffany also participates in what I think is not official meetings, but ends up being once or twice a week meetings with the school physician, Dr. Alan Stern, and the director of school health services, Barbara Singer. We got earlier this week, and I'm hoping to get an approved copy for the Board of Health. I requested modeling of school buses and airflow on school buses to determine sort of, given their reduced student loads that they're going to take for passengers, what does that do to air quality? How likely is it? So I'm hoping to get a copy to the Board of Health later this week. It was fairly revealing. The Harvard School of Public Health has also offered to do modeling in some classrooms, which we're hoping to get done later this week. There are concerns certainly from the teachers union about spacing, about cleaning, about airflow. I know the town has some challenges in that some buildings like the Williams are brand new and have very modern, very efficient HVAC systems. Some buildings like the high school have 4 or 5 different HVAC systems, and they're kind of like Frankenstein's monster with different additions and extensions added on over time. Other buildings like the Mitchell are old and do not have any central air conditioning. So I think that finding a solution that fits sort of all those different environments and airflows is a challenge. But it's something the Public Health Department is spending quite a bit of time on, trying to help the schools and give them guidance. So I wanted to mention that to the board and certainly take any comments or suggestions that the board have.
So I think for the indoor air quality, I think that is going to be a big issue because it just seems from all the data that we're seeing that indoor activities are the highest risk activities there are. And I believe that the MERV 13 filters are kind of the minimum requirement in order to potentially filter the virus. And you need to have enough flow. So you need to have something like 5+ air exchanges per hour. Now, how a school like Mitchell is going to get that, I don't know. Whether they have to, move people around and do multiple shifts and, what have you, I'm not sure. But I think that, that's something that needs to be looked at very carefully.
Yeah, it's pretty complicated. I'm working on a lot of schools right now, and it really, MERV 13 is great if you're recirculating, but a lot of these systems have outdoor air, so it doesn't matter what the filtration is on what's coming into the building. So if you're 100% outdoor air, which we're hoping, it doesn't matter how you filter it. I think portable HEPAs is something that's going to have to happen in certain spaces. It's the only way really to deal with it where the source is. So I think I've been in touch with Tim and trying to assist, where we can too. The bus study was great. I think it's a really good start, really informative for people.
There was a classroom spacing concern as well, that somehow we're going down to 3 feet instead of 6 feet.
Oh, you're muted, Tim.
Sorry. I think in the state's Department of Elementary and Secondary Education, the guidance that they provided to school districts, they went away from the hard requirement of 6 feet. I think a number of school districts have found that a challenging piece of state guidance to respect, given that the state is still requiring 6 feet between diners and restaurants, even outside. Why would you require less for kids in a classroom setting? Which I don't know if actually anyone has a good answer to that question. So I think it's still up in the air. I think the schools were told by the state to prepare 3 options. One, a scenario where everyone attends in person. One, a scenario where everyone attends virtually and all the learning is done remotely. And one hybrid model that involves only a portion of the school community in person at any given time, but rotation between in-person and online learning at a frequency to be determined, whether it's 1 week on, 1 week off, whether it's a Monday, Tuesday, Wednesday, Thursday, or Monday, Tuesday, Thursday, Friday. I will tell you that I think given the superintendent's focus on the health of students and staff, and I don't think the superintendent will get frustrated with me. I think it very unlikely the all in-person model would be something that would fly in Needham. I think the question then becomes, is it feasible to do the hybrid model? And if so, what sort of safeguards and what sort of protocols are you going to follow? How often are you going to do it? What's the rotation like? How are you going to cohort? What's the cohort size? So I think a lot of that work is still in process, but I know that I spend now 3 or 4 hours a day on different school calls, it seems. So they're working quite hard to try to get the answers to those questions.
From the last meeting last week when Dan presented to the school committee, it seemed as though they were leaning towards the hybrid model with half the class in person for 1 week. Every student would be off on Wednesdays for, I think, teacher planning purposes. And then the next week would be online for that cohort and have the other half of the class come in. It seemed as though that's where things were leaning at this point. But there were over 1,000 parents on this Zoom call. And so there's a lot of interest and concern from parents on how we're really going to keep kids safe in these spaces. And as you all know, it's very hard for children to wear masks for several hours at a time. So I think these mask breaks and how we're how we're donning masks and doffing them in school is all going to be a very tricky dance to do with small children.
Absolutely.
So any other things on the COVID update? Move on to the letter, the diversity, equity, inclusion letter.
So this is a draft letter, and I think it's gotten feedback and comments from each member of the Board of Health and also from me a couple different times. This is in response to the board's interest at its meeting last month of both addressing the challenges that race makes and structural racism makes to the social determinants of health and ultimately to the community's health, as well as the concern about people appropriately voicing their First Amendment rights to protest conditions they find disagreeable, while at the same time having some safeguards or having some consideration for the public health challenges. We have since learned, not from data specific to Needham, but from data in other large cities that did have Black Lives Matter protests, that the gatherings were not considered a spreader event. There weren't any significant spike in infections as a result of those protests, at least the initial wave. But that is certainly in there, the request to alert the Public Health Division. I do want to, because it was a topic earlier, mention to the board that I have some concerns about the Public Health Division's ability to handle, I don't know how many more protests we're expecting, but if there were more, I think right now I feel the Public Health Division is kind of, we have a very limited bench right now, it seems. So I do want to throw that out as one caution, but then I also want the board to just focus on if the letter says what it hopes it would say.
What's your caution, Tim, specifically?
I think my caution is, as Tiffany mentioned, we're short a part-time nurse. We're losing a nurse intern. We don't have an emergency management administrator yet, although we hope to have one in place before Labor Day. The person that I think we're hoping to hire for that has a lot of potential and is very smart and capable, but doesn't have much public health experience. So it will be learning sort of the public health preparedness and community preparedness side of the job will be an area where he has to grow. So that will be something where it might be challenging for him to step in and help right away. So right now it feels like we also never replaced Rachel Kane, who was a part-time staff member who worked on a couple different projects. Right now it feels like the Public Health Division, is missing 4 or 5 people from its bench.
I understand that. I'm just wondering where the deficit would be. Is it a matter of we can't do appropriate contract tracing if we have large gatherings? Is it a matter of we're running out of the face masks? Because I think those are the two things that we're kind of going to be leaning on public health to provide if there are a lot of gatherings, or unless you see another function that I'm missing?
I guess I wasn't even focused on those, although those are two really good considerations, and actually might be more important than what I was wondering. I was just thinking about the time and bandwidth it takes to wrangle in cases that have been, for example, student run. There's not a clear organizer. There's multiple people. You've got to try to find different people's emails and call them. Even getting on the phone to talk to them about their plans and make sure they're have spacing and mask wearing and things like that in mind takes time. That's not to say it's not important, and it might be that we need to emphasize that, but I worry a lot about sort of responsibilities that are beyond the department's core responsibilities right now. It feels like we don't have much bandwidth to tackle new challenges.
So outreach on being informed what's coming, and then also probably mobilizing, like getting somebody out there handing out masks literally on a Sunday afternoon, right? Is that sort of what we're thinking, or?
That would be a concern as well, absolutely.
Yeah.
I mean, I think right now is an interesting example, and it's slightly off the topic, but we have a warming and cooling center plan. The current heat wave wouldn't actually trigger the opening, although we might need to reevaluate whether our triggers are set too high. If it did trigger an opening of our plan, we don't have a revised plan that accomplishes a cooling center with social distancing in a time of a pandemic, and we don't have the staff to run it. And I think, that's something that I need to work on in terms of trying to get other staff and get other resources, but it's, the tank is not full right now for public health.
Is there any way, or would it be appropriate to mobilize the volunteer medical corps to help out with some of these things?
Mm-hmm. Absolutely, and Tiffany and Talib have done a great job sort of adding people on. I think that's the challenge potentially with your volunteer corps is, depending on when it is, they're not necessarily available, although it is certainly one option. I think we always, when we're bringing volunteers, have to have some staff members to help organize and structure it. But our MRC is certainly a resource we would hope for staffing shelters, but also warming and cooling centers.
It's also a matter too of if we were to open a warming or cooling shelter right now, me organizing the MRC is not a good availability or option for me with the hours that I am currently working. So that's another thing on top of that. It just, training those MRC members is not going to be an easy task if we have to do something like that right now.
In a time of contact tracing and follow-up and case investigation.
Yeah, with reference to the letter specifically then on page 2, where we say where possible we will provide facial coverings for those who might not have them. That is factual, but yes. I wonder if that puts in kind of a false sense of security, for somebody who's contemplating. It's like, oh, public health will have the facial coverings for us. It's like, yeah, maybe not. So I don't know if we want to say something to the effect of, if you let us know in advance, we might be able to provide them. But clearly spontaneous ones, we make no such guarantee. Obviously we'll do what we can, but I don't want that to be, kind of an enabler.
Okay.
That should be a backstop, not an enabler.
Okay, so maybe just added with sufficient notice.
With sufficient notice, public health will attempt to provide facial coverings for those who may not have them, something like that.
But I think also even to say that our supplies are significantly limited, so the expectation is that you'll bring your own.
Mm-hmm. Yeah. Also, Tim, I think if you all were contacted about such gatherings, and we needed to do some sort of proactive messaging to reach people at that time, perhaps we could also lean on the PIO for that kind of assistance. I do understand how your time is limited.
Yeah, because we have materials that are ready. I mean, they're in the can, right? You just it's getting to the right platform, right, to reach however the groups are communicating with each other. You know, I'm not totally in the know, whether it's, you know, Instagram or whatever, Facebook groups, you know, you just try to reach out there. I think that's how they're communicating. I mean, I'm sure there is some word of mouth and email perhaps, but, or, you know, phone, text message groups or something, but for the most part, you know, there's a lot of avenues to get some of this material out, I think.
Right, and in general, it seems like the same 2 or 3 groups that are organizing a lot of these things, you know, there's maybe, you know, 1 or 2 groups at the high school and then maybe 3 community groups.
And even if it's not the same groups, it's likely to be the same people involved. Like, so that you might be able to use them as an avenue to find out about these things.
Yet another reason to develop these connections to these groups, you know. So, okay. Did we want to discuss anything else in the letter, or how are we feeling about? I like the language that was added since I last saw it. I think it looks, you know, is more public health focused too, which is good. Any other comments or edits?
I like this letter. You know, I agree. I like the, excuse me, the edits that were added. And I like especially the additions of what Needham Public Health has done to address disparities in the social determinants of health in the past. So,
you know, in just hearing, I can't remember who was talking about it, that there is some sort of racial equity committee that has begun at HHS. Is there something like that? I wonder if we might even want to include a line about that.
So I think that's potentially a good one, although, and Karen and a number of staff members are obviously participating in that. The reason I chose not to include it is right now, I think it's internally focused, I think, rather than providing specific services to the public about this. It's trying to sort of, and eventually it will serve the public by virtue of us having sort of thought more deeply about how the social determinants of health, and particular, you know, systemic racism affect maybe how we structure goals and objectives and what we're trying to accomplish. But since it wasn't, I don't know if it's directly helping the public right this second. I was thinking it was more of an internal thing right now.
I guess I like that. I guess I think it's, yeah, I mean, it's showing that we're taking it seriously and we're starting to clean up your own house first, kind of. I don't know. But
we could certainly add a line about that if that's what the board thinks is appropriate. Yep.
I mean, you kind of have it in that last sentence of the paragraph. It just gives you flexibility. I mean, I don't feel strongly one way or the other, but if it's a brand new thing that's, you know, somebody's going to ask you about what exactly it's doing, and right now it's kind of in the formative stage, as long as you're comfortable with that response, I think we're okay.
Yeah, I think that is something worth including.
If I could just add, I'm not sure that if someone asked me tomorrow that I would be ready to explain to them exactly what our process is. We're, you know, just 2 meetings in. We're working through all of our groundwork for how we're going to move forward. I would also ask Lynn if she had an opinion about this. She's been very instrumental with me and others.
I think in a more vague way, it's safe for us to say that the health department is doing is looking at the issues in terms of how we provide services. I don't think it's wise to name the committee at this point because it is just barely formative at this point.
Thanks, Lynn.
So if the board is okay with it, then we'll include a sentence about the effort and the concept generally, but maybe not specifically name it. And we'll put that in maybe just above as the board looks to develop its own goals and the goals of public health division, we know consideration for that sentence.
Okay, I think that sounds good.
And
I think, Kathleen, you had just mentioned adding that one word in that second line, we're in the midst of a pandemic while also witnessing the longstanding racial injustice faced particularly by Black people throughout the country.
Yeah.
And I think, yeah, I think that might.
it's all, just the word particularly.
Yeah.
I don't want to get lost in this people of color, like, you know, it's not a great phrase. And, you know, even in the scientific literature, if you're saying you did a study, you know, you use Black and white, and Latino or Hispanic, right? And in the scientific literature. So I know people are using this abbreviation too, because it's easier, but.
What, so where does the board want me to?
So let's see, it's the second sentence. We're in the midst of a pandemic while also witnessing the longstanding racial injustice faced. Now I can't remember predominantly.
Particularly.
Particularly.
Okay. Yep.
Indigenous. Can we just say Black, Indigenous, and Latino communities? Do we ever use the abbreviation later on? We don't. So we don't even need the BIPOC or whatever that abbreviation is. I don't know how people feel about that.
Okay, so Black, Latinx, and Indigenous communities.
Well, unless you want to put that phrase right up there in the beginning, but.
I kind of like them. I mean, yeah, people can decide. I kind of like the emphasis on Black. That really is the movement. And we also want to include others in the bigger picture, but I don't know, what do you guys think?
Yeah, I think so. I mean, I think, you know, the BIPOC group faced a lot of challenges, but I do think the Black, the challenges particularly to the Black community and, you know, in terms of structural racism and lived experience is so different from other groups that I myself would belong to.
Mm-hmm.
Okay.
Mm-hmm.
I like it the way we have it.
Okay.
Addressed twice, and then the Black, Indigenous, people of color in the next paragraph.
Okay.
I would agree, and that's kind of a standard terminology that I've seen elsewhere as well.
Okay, so sorry, I've been making kind of edits as I go along, and maybe I shouldn't have yet. How do we want to?
Maybe we just leave that second paragraph as is.
Mm-hmm.
The second paragraph. Okay.
Mm-hmm. Or yeah. Mm-hmm. Yeah, and then just add the one word. Particularly, yeah. Okay. We're getting low on time, and so we're agreed with those edits. We'll send the letter that way.
Yeah, if you could, maybe the board would vote on wanting to send that letter. It's not a form of order, so a vote wouldn't be required, but if the board vote on it, I think it would be helpful.
Okay, so do I have a motion to approve the letter with the edit?
So moved.
Okay.
Second.
Okay. All those in favor, Christina?
Yes.
Mm-hmm. Rob?
Yes.
Steve?
Yes.
Rob? Ed?
Yes.
Kathleen? Yes. Okay. Great. Moving on to the next. Oh, so next is goals and objectives, which now we've gone through the time on. I mean, this seems like it would warrant a fair amount of discussion. And do we need to have these complete this week, these goals?
We do not. Most of what's presented here, or all of what's presented here, are goals that the board set previously for the fiscal year 2019 and fiscal year 2020, the year that just ended June 30th.
Mm-hmm.
The status of how far the division got along to meet those goals. I think we do want to start the process with suggestions from the board and the staff and the community about goals that the Public Health Division and the Board of Health should have for a 2 or 3 year period going forward. But at this time, we were going to just review the status of what we've done to date identify areas where work is incomplete, but maybe it wasn't actually the right thing to accomplish, or maybe it wasn't realistic, versus areas where we haven't completed things and we really do need to, and that needs to be a goal that's carried over to the new period.
Okay. So is this kind of, we should go through these on our own and give feedback? Would that be helpful, or we're kind of trying to slog through all these?
I think the board could certainly go through them and then we could discuss them at the next meeting.
Okay.
However you would like to proceed, though, it's certainly up to you.
Okay, folks feel like, I mean, I don't think spending, this would take ages to go through. I think if we each
I
go
think it'd be better if each one of us
Yeah.
looked at them and came up with some ideas.
Okay, yeah, I've put some comments in here, but I can, send a PDF or something with notes and items. Okay, so can we all commit to review this and give comments on this by our next meeting?
Sure.
Okay, that's a plan. On to,
So the next topic is just whether the Board of Health wishes to discuss, and I had emailed the board, select board and the town manager provided me with alcohol regulations, and the select board is considering changes to alcohol regulations, and actually has adopted or is going to adopt a process where it will reduce the liquor license fee for establishments in an effort to support and encourage business. I thought it might be an important time to potentially discuss alcohol regulations. And I think, one of the things that, and it's a little bit challenging, but defined penalties, I think one of the things about defined penalties is that they're very clear and transparent and fair. And I worry when you give too much discretion, that's where biases, implicit or otherwise, sort of creep in, right? If everyone knows what the rules are and everyone knows what the repercussions for violations are, then everyone understands, and it should be a level playing field. If we allow discretion or leniency because some group goes to the same meetings as someone else, or some group has sponsored this community event for years, that's where things seem less than equitable. So in my mind, I think defined penalties are important for a number of reasons, but if we are serious about equity, it's something that should be part of the discussion, is that having a system where we can give people the benefit of the doubt based on sort of how a handful of people feel is not a clear and transparent and equitable system.
hence these new violation guidelines, did those already get approved by the select board?
So at least in my mind, I don't think they're clear, or I think they leave something to be desired. There's certainly an improvement over what has happened in the past, where it really was, we'll take every case on a case-by-case basis. I think, as I said, I think 10.2, the board will consider the violation alleged, the facts of the case, and other relevant factors. I think that's challenging. I think there's been a number of times that tobacco vendors have sold underage, and there has been, it was very busy. It was a new trainee on their first day, a number of mitigating factors. And I think the challenge is it allows the perception of favoritism or bias to creep in. If you have clear rules that apply to everyone, that everyone knows in advance, I think that's a fair system. So.
I agree with that. I think the one time we made an exception to a tobacco enforcement turned into a fiasco. And so I think that it's important to have clear rules and just enforce them across the board.
Yep.
Dude, Tim, can you just explain, how does this process work? Because the select board wrote this, right? Are they looking for feedback, or?
They provided it to the Board of Health and to other boards, just sort of as a, hey, we're looking at this. I think it was not a specific request for comments. I don't know if it was we also don't want your comments. I'm not sure if it was like that. I think it was more of, here's something you may wish to consider. And I think it's been a topic of discussion between the Board of Health and the Select Board on a couple of occasions before. And I was including it because I know that the board has in the past pushed for maybe somewhat more control over the alcohol licensing process, for the Select Board to take the process more seriously, to have defined penalties, to have compliance checks, which thanks to Carol and Karen and the substance use prevention teams, and Chief Schulter most especially, Needham does now have alcohol compliance checks to mirror its tobacco compliance checks. But I was presenting it just for the board to decide if it wants to do something formally with this issue, if it wants to do something informally, such as individual board members talking to the Select Board or the town manager. It's sort of to your taste, Board of Health.
I mean, a one-word change, I think, would go a long way in 10.1. Instead of may be grounds for action, shall be grounds for action.
Yeah, something.
It doesn't limit what it is, but the reason that I want that would argue that that word is important is not so much for what the penalty winds up being, but because it is then, it must be a formal action, it must be public.
Mm-hmm.
And, you know, so this can't be swept under the table anymore.
Right.
I'm sorry to the board, I have to actually step off. I know Tara's going to help with any other parts of the meeting that are necessary, but I have to step off. And I'm not going to end the webinar because I was on the webinar when someone did that when they were the host, and it ended very quickly. So I'm just going to...
Yeah, so that would be one edit, so shall be grounds. The board will consider, I mean, that, yeah, 10.2 is definitely soft.
I'd also be interested, I mean, they have a 5-year tolling period for the penalties. I'd be interested in what those penalties would have been, you know, sort of how many of these businesses would actually fall under that. Because I think, you know, I think the Sheridan had multiple violations before they finally suspended them for a day or two.
Yeah, they did.
Right. I just wanted to say that the data with the SAPC regional compliance checks, alcohol compliance checks, with the multiple sales to minor violations that Tim has really worked when we wrote the grant to mirror the good work of the tobacco prevention and the quarterly tobacco compliance checks, the licensee training that Tara has committed to, and the defined and clear penalties was the goal of our regional grant. And I feel that the data in Needham with the multiple failures, you know, 9 one quarter and, you know, 8 was the catalyst to say we need to have some clear and defined penalties. And because as boards of health, we don't permit liquor licensees, it's more of an advocacy and position to be able to clearly support having these regulations enhanced so that there is a clear and defined penalty system and it's public and no one has preferential treatment. So I appreciate any kind of support and action that as a board you all will do, because we saw from your work years ago when these comprehensive programs were put into place, compliance checks, enforcement, and a training of licensees, the use rates of tobacco went down, and we know from our youth, our alcohol rates are high. We also have the data through the Metro West Adolescent Health Survey, the questions we added. I bought liquor in the town I live in Needham, and outside of my town. So with the regional effort, we're trying to get communities around us to also have clear and defined penalties and licensee training. With COVID, we had to cancel our last tips training because it was May and it's in person, and we have 9 trainers now, so we don't have to pay. But tips is allowing us to do virtual trainings. So we just met with chiefs and the public health directors, and that will be an option we offer across the 4 towns because we haven't had any tips training, which mitigates overpouring and sales to minors. So that 5-hour session. And additionally, we weren't able to do the alcohol compliance checks due to COVID. So what we're shifting to is non-police involvement alcohol purchase surveys, where adult over 21 people go in, attempt to purchase, and then give a card, thank you for asking me for my ID, or, you should have asked me for my ID, and these are done across the country. It takes away the police, and it allows us to track and reinforce with alcohol licensees across our 4 towns that public health and police and community leaders are still, despite the challenge of the pandemic, committed to proper sales and not overpouring. So they would go into takeout, Section 12s, as well as Section 15 restaurant and bars. And those were in Needham and across our 4 towns, the ones that had the highest violations, bars and restaurants of minors. So thanks for listening, and thanks for any support you can lean in. And I do want to say, I know we're short on time, but Zendalee is committed to stay on, and she did incredible work with Needham Youth with a photo voice project that she'd like to be able to present to you at a future meeting. Also with a survey with youth on what their perception of alcohol and vaping and other drugs are in the community during this pandemic. So she has a great PowerPoint that Needham Youth took pictures and can give you some perception and feedback from the kids in Needham during this past spring.
Thanks for sharing that, Carol. I think that's so important to maybe for our board to think about how we can share these survey results and all of this information with the select board, because I don't know if they have, if they understand the pervasiveness of alcohol use and abuse amongst our young people. It definitely feels as though we should have a response or discussion in whatever way we choose with the select board about these most recent changes.
I think at some point, maybe we should ask to just make a presentation to them or with them as a board.
Yeah, I mean, I don't know what other people think of the violation guideline penalties, but they seem pretty weak to me. I mean, underage drinking is a huge public health problem. As an emergency physician, when I think of underage drinking, I think of trauma, violence, sexual assault. Those are huge issues. And I think a message from us to the select board about that.
I think, yeah, that's what they need to hear that.
Plus, I think the photo voice thing, to just show through the eyes of teens what they see, what the access, the availability, I don't know. I think some of these are really light. Be interesting to see other towns or states, or I don't know how else this is regulated in other places, but it seems light. And the first one is, come and talk to us. Maybe we'll just send you a warning, right? That's sort of the old way of doing things. And the other ones get more specific, so. But 5 offenses before you get closed for 10 days?
Yeah.
Seems like a lot.
So I can have Zendalee, she's on, and present to you perhaps at our next meeting, her PowerPoint, her work with Needham Youth, and give you their voice. And again, we had that same voice last year, and in some of our towns, Dedham and Norwood, we have Westwood as well. They're not nearly as active at this time. But I suspect with Chris Coleman now, they will be presenting to their select board, because the youth voice is powerful.
Presenting to the select board, I think is a great idea. Okay, so
what is our time frame, I guess, with these regulations that the select board has? Are they looking to enact these sometime in the near future?
I don't know.
Yeah, I don't know what the plan is.
Okay.
I think Tim's probably would be our best.
Wait till our next meeting.
I can text him.
Yeah, that's fine. But yeah, I think we should give some feedback, if not a presentation, to the select board. I think would be great. Okay, so Tara, I'll just talk to you offline. Yet again, they send a lab report with no negative, no non-detects. Like, I want to know what they tested for and what the detection limits were. Are you kidding? They just did what they measured. I'm like, oh, just
we'll coordinate a call, maybe again, a conference call with
okay. It's a small thing. It should just be a complete lab report. That's all. Okay, because that's what you want to say. We tested for benzene. We tested for all these things. We didn't detect it. But now we say, oh, we detected these 3 compounds. It's just a waste. Trying to get to finish on time. Further on, I was approached, the League of Women Voters is working on this Meatless Monday program, and they asked if they could get the support of the Board of Health for this. My family signed up. It's been, we're not always meatless, so it's been a good practice for us, and just thought I would get people's thoughts. They put together a nice piece with real scientific peer-reviewed literature citations, which I like, things like that. So I just thought I would get people's thoughts on that.
I think it sounds like a good idea overall.
Okay.
Yeah. I don't know about Meatless Monday. It could be any day of the week, but.
Well, and I have to admit, it's become Meatless Tuesday because we always have leftovers on Monday for us. So
From Sunday dinner. Yeah.
One day a week, is exactly.
It's Taco Tuesday.
Don't tell anyone. Yeah.
What are they looking for from the board?
So they're looking for us to, our endorsement basically. And then I had a question, and I guess maybe for Tim, or if anyone else knows, whether we're able to have our logo go on their publications too, like endorsed by the Needham, Board of Health or Division of Health or something. So I think that's the idea, just to say this is endorsed by the Needham Board of Health, is a thought.
Yeah, that sounds good.
And can I just interject? I asked him if there is a date that the Board of Selectmen will be voting to approve these changes, and he said not that I know of. So any feedback you have or advocacy would be valuable, but it doesn't seem like this is going to happen soon, as far as he said, not that I know of, but we can follow up with Sandy Sincata.
But our next meeting is until early September, so we want to make sure.
Yeah. I don't think they'll do anything in August much either.
Yeah, right. That's probably true. Okay. So, so in whatever manner we're allowed to support this, maybe we should just take a vote on endorsing the Meatless Monday Needham campaign. Does that sound okay?
Sure, I'll move that.
Okay, great. So I have a motion to support Needham's Meatless Monday, or Meatless Monday Needham program.
Sure, I'll second that.
Okay, great. All those in favor? We'll go around. Rob?
Yes.
Steve?
Yes.
Ed?
Yes.
Christina?
Yes.
Okay, Kathleen, yes. Okay, great. So trying to finish almost on time. Any other items? We have our meeting set for September. We'll all review those goals for next time, so we have feedback on that, and hopefully we're wrapping up. Can I get a motion to end the meeting?
All right, I'll move to end the meeting.
Okay.
And a second.
Okay, great. All those in favor? Kathleen, yes. Christy?
Ed, yes.
Yes.
Okay.
Steve, yes.
Yeah. Great. All right. Thanks, everyone. Almost on time.
Thank you. Thanks so much for making that
All right.
happen.
Thanks, everybody. Take care.
Okay, we'll see you.
Thank you.
See you.